Welcome to This Explainer. Today, we're exploring a seriously fascinating and super relevant topic, medications that can change your heart rhythm. Now, before we jump right in, just a quick but very important reminder. This Explainer is strictly for educational purposes. It's all about building awareness, and it is absolutely not a replacement for personalized medical advice from your actual doctor. We're just here to decode the science so you can be a proactive partner in your own health. Okay, let's get into it.
Here is our roadmap for today. We're going to cover the heart's electrical system, understand QT prolongation, look at medications that affect rhythm, discuss other heart rhythm changes, figure out who's at higher risk, and finally go over staying safe and monitored.
Section 1. The heart's electrical system, the circuit board inside you.
So, you might be wondering, how exactly do everyday pills, the kind you swallow for a simple infection, a cold, or maybe a mood disorder, end up altering the fundamental, life-sustaining rhythm in your chest? It's kind of wild to think about, right?
Well, to answer that, we have to look at your heart not just as a mechanical pump, but as a highly sophisticated electrical circuit board. And this internal circuit board relies heavily on specific electrolytes. We're talking positive and negative ions, stuff like potassium, magnesium, sodium, and calcium. Actually, think of these as the literal power source moving through ion channels in your cells. They generate the precise electricity that tells your heart muscle exactly when to contract, which is what keeps you humming along at a normal resting rate of about 60 to 100 beats per minute. When certain medications interact with these electrolytes, or the channels they flow through, they can sort of scramble the signal.
That takes us to Section 2, understanding QT prolongation, the recharging phase.
This is the core mechanism we need to talk about. You might have actually heard the term QT prolongation tossed around by doctors, or maybe seen it buried in the fine print on a warning label. But what does it mean in plain English? If you picture an EKG, that squiggly line mapping your heartbeat on a monitor, there's a gap between what's called the Q and T waves. The QT interval is essentially the crucial recharging time for your heart's lower chambers, the ventricles. It's the split second between when your ventricles squeeze out blood and when they fully relax to refill. When we say you have QT prolongation, it just means this specific recharging phase is taking a fraction of a second too long.
Now pause for a second. The word prolongation can sound super alarming, but we really need to put this into perspective. Severe side effects from this are incredibly rare. Seriously, millions of people safely use medications that can cause this every single day and literally never notice a thing. The goal here today is awareness, not to make you terrified of your medicine cabinet.
But the difference in the rhythm is pretty stark. A normal rhythm has a quick, highly efficient recharge. A prolonged QT interval has a sluggish recharge. And why does that even matter? Well, if that delay stretches out too long and another electrical impulse fires off before the heart is totally ready, it can trigger a rapid, chaotic, and dangerous abnormal heartbeat. Medically, this is called torsades de pointes. In severe cases, it can cause fainting or even be life-threatening.
Moving on to Section 3, medications that affect rhythm, the common culprits.
Let's look at the actual medications known to mess with this rhythm. Some of these will absolutely surprise you. Ironically enough, anti-arrhythmic drugs, which are literally meant to fix rhythm problems, are actually the most likely culprits. Since they work directly on the heart's electrical system, drugs like amiodarone fall right into this camp. But the list also includes incredibly common stuff. We're talking certain antibiotics, including macrolides like azithromycin and fluoroquinolones like ciprofloxacin. We also see this risk with certain antipsychotics, like chlorpromazine and zabrazidone, as well as some antidepressants, including tricyclics like amitriptyline and SSRIs like citalopram. And honestly, the list is growing to reflect broader classes, including certain anti-cancer agents and neurological drugs too.
Now, beyond just QT prolongation, everyday medications can directly speed up or slow down your resting heart rate. ADHD stimulants like Adderall can bump your heart rate up by about 5 to 7 beats per minute. Asthma bronchodilators like albuterol open your lungs but also activate receptors in your heart, speeding it up. Even popular weight management drugs like Wegovy or Ozempic can cause a slight 1 to 4 beat per minute increase. Got a cold? Pseudoephedrine in things like Sudafed will definitely raise that heart rate. Oh, and diuretics or water pills don't directly target the heart, but they make you pee out fluids and vital electrolytes like potassium and magnesium. And as we just learned, those are the exact power sources for your heart's circuit board.
All right, Section 4, other heart rhythm changes, beyond the QT interval.
We should briefly note that medications can trigger other types of rhythm changes too. Remember, the word arrhythmia is just plain English for an irregular heartbeat.
Depending on the specific drug, this could mean bradycardia, where your heartbeat becomes abnormally slow. It can mean tachycardia, where it gets abnormally fast, or it could even trigger atrial fibrillation, which is a quivering, fluttering heartbeat.
Section 5. Who is at higher risk? Contextualizing the danger.
Since millions of people take these drugs without a single issue, we need to understand who actually faces a higher risk. Context is absolutely everything here. The risk goes way up if you start stacking the deck. Taking one QT prolonging medication? Probably fine. Taking multiple at once? That multiplies your risk. Underlying heart conditions or being over the age of 65 makes you more vulnerable. Also, if you deplete your heart's electrolytes through severe dehydration, like from a nasty stomach bug with vomiting or diarrhea, you can drop your potassium or magnesium levels, leaving your heart super susceptible. Finally, a personal or family history of heart rhythm problems is a massive red flag that doctors look out for.
To put this into perspective, doctors are looking very closely at one specific number on an EKG, 500. They get highly concerned when the corrected QT interval crosses the 500 millisecond threshold. That is the danger zone, where the risk for severe arrhythmias, like torsades de pointes, just spikes.
And finally, Section 6, staying safe and monitored, empowerment and action.
I really want to hammer this point home, straight from our source material. Most people can safely take these medications. The side effect is relatively rare. Our entire goal here is to empower you with awareness, not alarm. You shouldn't be terrified of your antibiotics or antidepressants, right? Knowledge just lets you be observant and safe. If you do have some of those existing risk factors, your doctor might just order a routine EKG. It's totally painless, and it just checks your heart's electrical baseline before you start a higher risk medication. They might even do it during treatment just to make sure you're staying well under that 500 millisecond mark.
So what can you practically do? Here is your everyday safety checklist. First, be completely transparent. Always ask about interactions when starting a new prescription, and tell your doctor and pharmacist about every single thing you take, including supplements. Second, listen to your body. If you feel unexplained dizziness, if you faint, or if you feel crazy heart palpitations, report it promptly. And third, literally the most important thing I'll say today, never ever stop a prescribed medication abruptly out of fear without talking to your doctor first. Stopping cold turkey can cause far more immediate harm than the rare side effects we've been talking about.
I'll leave you with this final thought. Have you sat down lately and looked at everything you take? From your daily prescriptions to that random cold medicine in your cabinet. Awareness really is your absolute best defense. Take this knowledge, have a great conversation with your doctor, and keep that internal circuit board running perfectly. Thanks for joining me on this explainer, and stay curious.